My name is Amanda Burns. I am a Muscogee Creek Nation citizen, and I'm fighting diabetes.
I'm Tiana Haas, and I'm from Coweta.
My name's Alan Harcrow, and I'm born and raised Tulsa. I'm 62, Berry Hill class of 79. About 10 years ago, going to the Coweta clinic, after lab work, I was diagnosed type 2 diabetes. I had no clue what that was. I've heard about diabetes, diabetic, that kind of thing, but Dr. John Harjo explained to me what's going on, and he said it's not because of your intake, it's because of your genetics. It's going to happen. Some people it doesn't, some people it does. It's happened to you. So from now on, your intake and your activity does affect the quality of your life.
I got diagnosed in 2014, and it sort of I went through the grief process, which, I was in denial, and so I didn't, do what I was supposed to do. And then, I went into, being real depressed about it, and then just kind of acting like it wasn't there, just ignoring it, hoping that it would go away. So it was just progressively getting worse, where my labs were coming back all janky and high and all this. And then I lost my mom in 2016 to complications of diabetes. And then after that, I sort of tried to kind of make some changes, because it really scared me to watch her take her last breath from complications due to this disease. But I still wasn't in it fully. And so, eventually I made the decision to, have my primary care doctor refer me to an endocrinologist, and it so happened Council Oak had one available, and that's who I started seeing, Dr. Bruns.
I was diagnosed in around November of 2021, and so I've worked with the doctors here at the Coweta Indian Clinic, and they kind of helped me with the medicines and get back on track and everything. So I went from taking, seems like tons of medicine, down to like 3 or 4 right now. So I just had a recent update, or a recent doctor's appointment, and so I got taken off of a lot of those medicines.
It is difficult to lose weight when I'm on insulin, a little bit of insulin. And when your body's on insulin, the body wants to hang on to the fat. So that makes it difficult to lose weight. Plus, in my side of the family, we like to eat, and we don't lose fat easily or naturally. I so envy the guy that his motor runs at a high level and he stays thin his whole life and he's got energy. I'm not that way, so I have to work at it, and that's okay.
So the biggest challenge for me was overcoming the cultural background of how I grew up, because as natives we center everything around food, and which is good. I mean, that's a good thing, but it's not, we centered it around not so healthy foods. And that's not how our ancestors did. Our ancestors, ate off the land and they were healthy. But as, time went on, we've kind of gotten away from that. And so that was the biggest thing for me to overcome, was the cultural, beliefs of, just, having to finish your plate, and, being real insecure about going to the doctor and getting the help that you need. I mean, I would just go to the doctor if I was feeling like I was, gonna die, instead of going like normally like we should.
I think the hardest thing is being native. you always love to eat, so it's basically portion control and just kind of watching what you eat.
Doing research, really, just going back and doing the research on how our ancestors lived and how they lived before the settlers came, it was a real eye-opener for me that we didn't eat like we eat today, and it was because the settlers came in and brought us all that bad stuff. And so it was that was a real eye-opener for me. And so I started making changes on how I was, eating. And so it was just those lifestyle changes, to beat, those cultural things that we grew up with, thinking that, that what we were doing were okay. And just getting that mindset that, we don't have to die at a young age. We don't have to die due to complications of diabetes. We don't have to. There is, medicines, there's the diabetes program and the programs within that program that are there to assist you. And I guess I wasn't fully aware of that either until Dr. Bruns, because she had me seeing everybody. And I just never knew that those things were there at our fingertips as citizens of Muscogee Creek Nation. We can utilize those things so we can get healthy, so that we can beat diabetes and don't have to die from it.
Actually, it's not been too bad. So I have the monitor that tracks my sugar and stuff on my phone, so it beeps at you whenever you get high or you get low. So it kind of holds you accountable. So when you're at work and it goes beeping, then your coworkers are looking at you. Okay, what did you eat, or do you need to eat, or whatever. So it's just time and balance, basically.
About 3 years ago at the clinic, my diabetes case nurse, her name was Leah Dearman, and Leah helped me so much. She was so informative, and she introduced me to a meter that goes on your skin, and it was called the Libre 2 system. So you put the meter on, and it's good for about 3 weeks, and you download an app on your phone, and you take your phone, push the button, and scan the meter, and it tells you your blood sugar level, and the phone sends the message the information to the clinic. The information that this provides has been key for me to doing the things that I need to do, living the life that I live, creating the habits, whether it's diet or activity, to maintain a healthy blood sugar level and A1C number.
My best advice to them would be just to listen to your doctors. The diabetic clinic here at the Kerretv clinic, they've helped me through a lot, and so just reach out to them. They'll help you the best they can, and they're always there to help you out.
I would say, first of all, go to your clinic and get with your doctor and have a good long sit down with the doctor and follow his direction. Even though you may not understand what diabetes is, what it does to you, what the long range effects are, learn as much as you can. Get on the internet. There's about anything you want to know is on the internet. So study, do research, and then talk with your doctor and follow his direction.
Get ahead of it now. Don't wait until you turn a certain age or until something drastic happens to you. There are so many programs within the Department of Health that you can utilize, and these people, they're willing to help, but you just have to ask for it. And they are totally there for you to, get ahead of these things before it's too late. And so that's the one advice that I would give, is just utilize these programs. They're free and they're willing to help, and they're there for us specifically so we don't have to die from this disease, and we can spend that time with our families, not worried about our health.
I'm Brandy Lang. I am the diabetes educator here at the Kerretv Clinic. I love my job. I love educating patients. I love giving them the knowledge and the skills, and to just watch them progress and take ownership of that. We're part of a team, so that's the dietitian piece, that's the pharmacy piece. Giving patients our direct number at our desk to say, if you have a question, call me. If something's wrong with your glucometer, call me. I'm happy to help. We're here to help. We see lots of patients, in the very beginning or early diagnosis, and then we work with them depending kind of on what resources we're using or whatnot, every month, or they come back to see their provider in 3 months and we see them again. And it is so cool to watch them on that journey and check back in with them, so to speak, and look back at not only their numbers, but then we talk about how, changes you've made, what you're eating, and how active you're being, and all those pieces coming together. And just to see them come in with a confidence and a completely different mindset of not being afraid or not being put down or intimidated by having diabetes, but knowing that they at home can do these things and that we're there to help them and work with them, and just the confidence that comes from that, and the empowerment, and almost, the excitement that they're impacting their health and that they're doing so much better.